As Director of Education, I'm also a practicing physician, and I use simulation to help myself improve. It's been a bridge for me from the medical book knowledge and the lectures to actual patient care.
All healthcare providers, whether they are day one, just starting school, or 30 years in as a seasoned clinician, simulation can help them in their practice.
Through simulation, we are able to work out kinks and figure out how best we work in the room with patients, as opposed to just learning book knowledge on paper. We are able to go into the room, practice, and figure out what little nuances we have, and we're in a supervised environment where our faculty are watching us and teaching us.
As a resuscitation coordinator, I work in one of the most high-stress, low-frequency type situations. When we show up, the patient is technically the most critically ill, and a lot of times those situations require split-second decisions. So simulation allows us to really practice and hone in on those skills so we don't make the mistakes in real time, so that we can focus on saving those patients that are super critically ill in those really low-volume, high-stress situations.
Communication and teamwork. These are things that we actually don't use or learn in medical school or in nursing school and PA school, but we have to use every day on our jobs. And so to actually get in there with an interprofessional group and take care of a complicated patient together and use communication skills and teamwork can be very powerful.
I think my favorite thing about being in simulation is watching a student from the beginning of their rotation be so green and uncomfortable talking to a patient to the end of a rotation where they are able to think critically. It's that moment of being able to mold them and help them gain confidence. That is something I really believe in.
Simulation helps physicians in that we're always learning. Even the most seasoned physician needs to be open to new procedures, new ways of doing things, and simulation helps them to stay up to date on their knowledge. For students, it is also very helpful because they want to practice on a simulated patient and not harm a real patient. And so they're learning the basic skills often. And for patients, I think it's very important. Patients want to see the doctors using simulation and practicing on mannequins, task trainers. It improves patient care and quality of care, but it also lets people and patients to be confident in their doctor's abilities, that they're not trying out things for the first time on the patient.